us once again to give us the latest updates about the COVID-19 pandemic here in Kern County and across the country. Dr. Kothary, the Chief Medical Officer for Dignity Health Central California Division. Dr. Kothary, good morning again. Good to have you with us.
Well, good morning to you as well, Med.
One thing we just want to keep talking about because it is really starting to ramp up now is the convalescent plasma donation. You are one of the, excuse me, I'm so sorry, everyone. One of the lead investigators who is working with this trial right now. Let's talk about the results. I know we talked about them yesterday, but everything changes day by day with this virus and with these treatments. What are we seeing, and what do you want people in the community to know?
You know, this is the one treatment that has no bad studies against it. It truly is a miraculous treatment. It's our last in the arsenal, and it does work. And so what we need is we actually need all those people that have been tested and are now recovered or symptom-free to contact the Houchin Blood Bank and see if they can donate some plasma. We are in dire need of some plasma right now.
What kind of patients are eligible to receive the plasma treatment?
Anyone that's had a positive test and is now symptom-free, at least 14 days out, or the Houchin Blood Bank has even taken antibody tests. If you've tested positive for COVID-19 and then had an antibody test, they're taking that as well.
What kinds of patients who are currently fighting the disease, though, are you at a rather severe stage before you can take this plasma treatment?
Yes, so we've signed up with the Mayo Clinic in order to join their study. And some of the guidelines are you have to be really sick in order to get this plasma, primarily in the intensive care unit. So a lot of really sick people can benefit a lot from your help.
Any numbers on how many local patients have received the plasma treatment so far?
I know it's upwards of 4 or 5. So, you know, we're still in our mishandling right now is the shortage of plasma. We'd give it to a lot more people if we had plasma available.
And there are some local businesses that are kind of teaming up in order to encourage people to donate that plasma, right?
Yeah, and you know, extremely nice people at Flames and Skewers have offered a $100 gift certificate to anyone that donates plasma. So I think very generous from their part. I think that's fantastic, and $100 at Flames and Skewers definitely goes a long way.
Okay, so again, if you have had those positive tests or those antibody tests, and you've also now been cleared of the virus, contact Houchin Blood Bank to see about if you can donate plasma as well. Let's talk about some of the new symptoms, because yesterday Kern County Public Health talked about the new symptoms, and the CDC added these new symptoms to the list of those that indicate coronavirus. We had heard for so long that things like chills and a headache were being more associated with the flu than coronavirus, but now they've added chills, shaking with chills, muscle pain, headache, and sore throat, and the loss of taste and smell to the list of those symptoms for coronavirus, right?
Right, and the thing with this coronavirus, it's like any other virus we're learning that has all these other additional symptoms. Initially we thought, well, it's fever, chest pain, and cough. Well, yeah, that kept getting broader and broader. Now we have a lot more symptoms. And I think that will keep expanding as well as we go along.
Does it mean, though, that you're going to have every one of these symptoms? Could you have just one or two? And does not having
Absolutely.
Another one mean you don't have it?
No, no, you can absolutely have just one or two. You do not have to have the whole gamut. You know, we have a lot of people walking around that have a cough and shortness of breath and no fever, and sure enough, they turn up positive for coronavirus. We don't know if that correlates to being more sick if you have more of those symptoms. We don't know that part yet.
Okay, let's talk about some new reports that have started to come out from doctors in New York City who are saying that they're seeing more strokes in young adults who are affected with COVID-19. What do we know so far about a possible correlation there?
So COVID-19 definitely attacks the lungs, but we know it puts a lot of stress on the heart as well. So we're not only seeing a lot more strokes, but we are seeing a lot more heart attacks, and then that can lead to strokes and other complications as well. So we're starting to see how this virus is attacking different organs.
And some of these reports seem to be in patients who really didn't have a lot of symptoms of coronavirus, didn't just seem to be very sick from it.
Right. And once again, I think it's just a gamut of symptoms that people get, and it just depends on what are their comorbidities that you have. And that's how severe you're going to get your symptoms.
And what does that mean? Can you explain those comorbidities?
So basically what that means is if you have any other illnesses, if you have diabetes, if you have high blood pressure, if you've had a history of strokes, or if you're under chemotherapy for cancer, anything that, or HIV treatment, anything like that will put you at a higher risk of having additional complications.
Okay, and then finally here, NBC News is now reporting a pug in North Carolina tested positive for coronavirus. We've seen these reports slowly trickling through. What do we know about coronavirus passing between pets and humans, and do we need to social distance our pets if we take them out for a walk?
You know, so about 3 weeks ago, I think I was asked the exact same question. I said, no, your pets cannot get it. And obviously I'm wrong, because things are changing so rapidly. We've heard of other animals get it. I don't think you need to social distance from your pet. A lot of people's pets are part of their family. You just stick with your family.
When your pet's out for a walk, should you make sure that it does not go up and sniff another dog or animal?
You know, I don't know the answer to that, but I think I would try and keep it as close to you as possible.
All right, so much changing day by day here. Dr. Kothary, we appreciate you continuing to answer our questions, and we'll see you tomorrow morning, sir.
Thank you, Maddie.